Hello, my name is Rolando from YourMedicare by AYA and Associates, where we clearly know that choosing a Medicare plan can be complex, convoluted, and just outright confusing. So, with over 25 years of professional experience, we make this process clear, simple, and understandable. So, today we're going to have a lesson on what original Medicare is. Most people out there, they have a red, white, and blue card, but they truly don't understand what it means or how it's applied. So, in today's lessons, we're going to teach you a little bit about original Medicare. Okay, so let's get going. This is my contact number if you need it, yourmedicarecoverage.net, yourmedicarecoverage.net, and my phone number is 1-800-381-3623, 1-800-381-3623, Original Medicare. I'm going to give you a little bit of a legal disclaimer because it is important to disclose that this presentation is just a brief of the main topics associated with original Medicare. Original Medicare is more complicated, applies to people differently. It is important that you get the advice from a licensed and experienced professional to ensure that you get all of your questions answered specifically, or as it says in the specifically answered. Okay, so in today's lessons, we're going to learn about 8 different things, and we're going to start off with number 1. What is original Medicare? Who is eligible for original Medicare? A picture of your Medicare card, if you don't even know what it looks like. What are the parts of Medicare? What does each part cover? What is not covered by original Medicare? How much does it cost? And when do you enroll? A lot of people just don't know when to enroll with Medicare. Some people do it automatically, and other people actually have to do it themselves. Okay. What is original Medicare? Original Medicare is a federal health insurance provided by the Centers of Medicare and Medicaid to help seniors with the cost of their health coverage. The program is funded by Social Security and Medicare taxes people pay on their income. So if you've been working for the last 40 quarters, which is equivalent to 10 years, and you've been paying into the Social Security with your taxes, which most of us are required, if not all of us are required to do so, the government basically gave you a contract, says you give us some taxes, and when you turn 65, or if you're disabled, legally we're going to go ahead and help you out with your health insurance costs. So this journey is about understanding what those costs are. Let's talk about who qualifies for Medicare. As I already stated, you have to work for over 10 years or 40 quarters. You have to pay into Social Security. You get your Medicare benefits when you're over 65, or if you are younger than 65 years old and been legally disabled for over 24 months, are receiving disability for that, receiving compensation for that disability. You're entitled to that. And also people with end-stage renal disease and amyotrophic lateral sclerosis, otherwise known as ALD. I hope I got that correct. Okay, this is a picture of your Medicare card. You probably already know that. It has your name, your number, the hospital coverage, its date it started, the medical coverage, its date it started. What's important to note here is that the numbers are different now. They have letters. You no longer have your Social Security. You shouldn't be giving out your Social Security to anyone, right? So if you haven't received your new Medicare card, then go ahead and call Medicare, and they'll send you out a replacement. Okay, what does Medicare Part A cover? Inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. If you need to know a little bit more specifics, basically there's a book called Medicare and You 2022, and it kind of covers in more detail because there's a lot of stuff, a lot of meat behind this general presentation. Important information about Medicare Part A. Most people don't have to pay a premium. Most people. You must pay a deductible of $15.56 before services even start. They've increased it substantially this year. There's a lot of frustration out there in the senior world, but it is what it is. And they also increased the cost of living payment, but they did something weird. They kind of increased the cost of living payment, so you receive more money on your Social Security, and then they charge you more for Medicare. So there's a little bit of outrage out there, right? You can't be turned down because of a pre-existing condition, meaning if you had a previous illness, you can't be turned down. If hospitalized for over 60 days, you will be paying a daily co-payment. We'll discuss those specific numbers a little bit later. You can go to any hospital that accepts Medicare throughout the United States. However, if you are outside of the United States and you are on vacation in the Caribbean someplace, those hospitals won't take Medicare. Okay, so keep that in mind when traveling. What does Medicare Part B cover? It covers doctor services, outpatient hospital services, laboratory services, durable Medicare medical equipment such as canes, walkers, wheelchairs, outpatient physical therapy, and some preventative cares. What does that mean? Some preventative care? Your yearly physicals, mammograms, diabetes screenings. More important information about Part B, you must pay a monthly premium based on your income. Okay, they've increased that also. We'll talk a little bit about the specifics a little bit later on. You're responsible for 20% of Medicare approved costs. There's no maximum out of pocket. And if you do not enroll in your initial enrollment period, you may have to pay a fine unless you fall into an applicable exceptions. What is an applicable exceptions? Means that you have credible coverage either through your employer or maybe you're a veteran. Okay, and also you can go to any doctor in the United States that takes Medicare. How much does the Medicare Part A cost? This is important, very important to kind of take note of because it starts accumulating, it gets very expensive, and we clearly understand that most folks in the senior world out there are on limited income. Okay, most people don't pay, let's say PAT, but that's a typo. Most people don't pay for Part A premium. If you need to purchase it, meaning that you do not qualify for 10 years of paying into the Social Security or 40 quarters, they will charge you $499 just for Part A. However, if you have worked some, like 30 to 39 quarters, Part A will only cost you $274. So it's better to kind of, you get that close, 35 to 39 quarters, might as well just kind of tighten your belt and get to the 40 so you don't have to pay these premiums for Part A, because typically if you have 40 quarters, 10 years of paying into the system, it is zero cost. Inpatient deductible. So if you have to go to the doctor, right, to the doctor, your deductible before it gets going is $1,556. Okay? If you're in the hospital as an inpatient, days 1 to 60 is zero, 61 to 90 is $389, 91 days and above is $777, and lifetime reserve. Beyond lifetime reserve, you have to pay all the costs. What's a lifetime reserve? I'm going to explain it very briefly because it could get a little complicated very quickly, and I have a definition on the next slide that we're just going to go right over. So if you have 90 days, right, of benefit period, 90 days you can go to see the doctor. From day 1 to 90 is your benefit period. If you have to stay there another 10 days, then you have a lifetime reserve, meaning the maximum amount of time that you can go to the hospital, you can take 10 days from that and add it into your first initial period, okay? I hope I made that clear. That is the whole goal here. But if you need more explanation on what a lifetime reserve is, let's go ahead and show you a definition here, right? So there's some stuff in there. It's a little bit more complex. You can read that on your own time. Right now, what I want to do is kind of give you a brief understanding and not get caught up. I want you to see the forest between the tree, and that's a pretty heavily leafed tree. Okay, how much does Part B cost? Well, as of 2022, they increased Part B to $170 or higher based on your income. Part B also has a deductible as of 2022 of $233, and you must take into consideration that you are responsible for 20% of all the Medicare approved costs. So you see how that can quickly start adding up. $170 for Part B, $233 for a deductible, 20% of the Medicare approved cost, coupled with a deductible or maybe a premium on Part A. And we clearly understand that most folks are on a limited income, right? And that could be or create a financial burden. So that's why there's Medicare supplement plans and Medicare Advantage plans, which we will cover at another lesson. So you avoid those types of burdens that may affect. So one of the questions is, when do you enroll into Medicare? When you're 65 years old, 3 months before your birthday, or 3 months after your birthday. This is known as your initial enrollment period. Okay, what happens if you forget to sign up? You may be subject to a penalty unless you have an exception, such as employer credible insurance. Another one, if you forget to sign up during your initial enrollment period, you may have other chances, such as annual enrollment period, and those periods stem from October the 15th through October the 17th, or something known as special enrollment period, and that could be a special circumstances. For example, when you move out of, there's several, so I'm going to just name a few. If you've been incarcerated, hopefully you haven't, and you get released, that's a special enrollment period. When you lose credible coverage from your employer or your union, that's a special enrollment period. Or let's say you move out of the coverage area, that is a special enrollment period. Okay, so moving right along. Understandable. Okay, to review your cost, I actually took a copy from Medicare.gov. I put it right here so you can use it as a reference. Okay, so this is Part A premiums, Part A deductibles and co-insurance, Part B premium, Part B deductible and co-insurance, Part C premiums, right? And then also Part D. Part D is but the whole goal here is I want you to focus on Part A and Part B. We're going to cover Part C. We're going to cover Part D. I just think that if you kind of bunch it all, you get a little bit more confused, right? And that's the whole goal, is to kind of demystify that. What doesn't it cover, right? So we kind of just spend a little bit of time discussing what Medicare covers, and this is what Medicare does not cover, okay? It won't cover your long-term care. It won't cover care outside the United States. We discussed that. It doesn't have dental, vision, or hearing. Cosmetic surgery, that's pretty obvious. Acupuncture, alternative medicines, amounts that are not approved by Medicare, and it only covers 80%. The other 20% is covered by yourself. So this is known as Original Medicare, okay? Original Medicare, to recap, basically is a red, white, and blue card, Part A and Part B, right? Part A covers hospitals and associated costs. Part B covers hospitals and associated costs. You clearly understand that you have certain costs associated with Part A. You have a deductibles, you have co-payments. Part B, you have a premium, you have a deductible. It only covers about 20%. So in short, that is Original Medicare. I hope you learned something out of this lesson. And in the next lesson, what we're going to do is cover Part D, because if you notice, Original Medicare, Part A and B, the red, white, and blue card, does not cover prescriptions, and prescriptions is a very important part of your health coverage. So I hope you learned something today. If you have any questions, don't hesitate to go onto my website, YourMedicareCoverage.net, and or call me at 1-800-381-3623. My name is Rolando Arellano. I'm the founder of YourMedicare, where we clearly understand that choosing a Medicare plan can be complex, convoluted, outright confusing. We make it clear, simple, and understandable. So I hope I was able to convey that in this presentation. Thank you very much, and you have yourself a wonderful day.